In 1999, the Nevada legislature passed a bill then known as Assembly Bill 280 or AB 280 that prohibits the use of aversive interventions and details the requirements of the use of physical and mechanical restraints on students with disabilities who are enrolled in private or public schools. In July 2009, the statute was amended to include other provisions governing the use of physical and mechanical restraints, and revised provisions relating to reporting restraints and violations. So what are we talking about? We are talking about the aversive interventions that are prohibited under this statute, the requirements for the use of permissible physical and mechanical restraints, and when the provisions of the statute do not apply to certain restraints, and the new reporting requirements. What is an aversive intervention? According to Nevada Revised Statute 388.521, an aversive intervention is any action that is used to punish, eliminate, reduce, or discourage maladaptive behavior of a student with a disability and is prohibited by this statute. There are 10 aversive interventions that are prohibited by this law. They include the use of noxious odors and tastes. For example, you cannot put hot sauce on the tongue of a student with disabilities to stop a behavior or punish this student. You cannot spray a student with water or use a blast of air to stop a behavior or punish that student. This statute also prohibits the use of chemical restraint, which is the administration of drugs for the exclusive purpose of controlling behavior. This does not include the administration of drugs prescribed by a physician. This means that you can and should send your students to the nurse's office who require their medications. The next aversive is verbal and mental abuse, which includes any actions or utterances that are intended to cause and actually cause severe emotional distress to a person. For example, calling a student with a disability stupid, idiot, or retard. Electric shock is the application of electric current to a person's skin or body, but does not include electroconvulsive therapy. The next aversive intervention is the denial or unreasonable delay of items needed to sustain the health of a person, regardless of the length of deprivation, including without limitation to food or liquid at a time when it is customarily served. For instance, if lunch is served from 12 to 12:30, all students must get their lunch during that time. You also cannot deny students their medication. The next aversive intervention, and probably one of the most important to understand, is the use of corporal punishment. Corporal punishment means the intentional infliction of physical pain. Staff are not allowed to use corporal punishment. No hitting, no slapping, no pushing students, no pulling students' hair. All of these are considered very serious violations of this statute. Another aversive intervention is the placement of a student alone in a room where release from that room is prohibited by a mechanism, including without limitation to a lock, device, or object positioned to hold the door closed. Years ago, students were placed in timeout rooms in order to control their behavior. Students are not allowed to be placed in rooms alone where they cannot get out. You cannot force a student to perform an exercise because he or she has exhibited a behavior related to his or her disability. So your students with ADHD who are overly talkative or disrespectful to the PE teacher cannot be singled out to run laps or do push-ups. It would also be considered an aversive intervention if you forced a student to exercise and the exercise was harmful to his or her health, or the nature of the student's disability prevented the participation in the exercise. There are two kinds of restraints: physical, using your body to limit a student's movements or hold a person immobile, such as wrapping your arms around a student to prevent him or her from hitting or kicking, and mechanical, which means using a device to limit movement or hold a student immobile, including without limitation to mittens, straps, or restraint chairs. The district does not recommend the use of a mechanical restraint unless a doctor has written a prescription for its use and it is written into the IEP. The use of a physical restraint on students with disabilities is prohibited by NRS 388.521 unless it meets the following three criteria. An emergency exists that necessitates the use of a physical restraint. The restraint is used only for the period of time necessary to contain the behavior so that the student is no longer an immediate threat of causing physical injury to himself, another, or causing severe property damage. And the restraint is used in such a way that the use of force is reasonable and necessary under the circumstances. The use of a mechanical restraint on students with disabilities is prohibited by NRS 388.521 unless it meets the following 9 criteria. First, an emergency exists that necessitates the use of a mechanical restraint. A medical order authorizing the use of a mechanical restraint from the pupil's treating physician is included in the IEP before the application of the restraint. The physician who signs the order or the attending physician must examine the student as soon as practicable. The restraint is applied by a staff member who is trained and qualified to apply the mechanical restraint. The student is given an opportunity to move and exercise restrained body parts for at least 10 minutes for every 60 minutes of restraint unless otherwise prescribed by the doctor who signed the order. A member of the staff of the school lessens or discontinues the restraint every 15 minutes to determine if the student will stop injury to himself without the use of the restraint. The record of the student contains a notation of the time the restraint was lessened or discontinued, the response of the student, and the response of the staff member who applied the restraint. A member of the school staff continuously monitors the student during the time of the mechanical restraint, and the mechanical restraint is used only for the period of time necessary to contain the behavior so that the student is no longer an immediate threat of causing injury to self. Note, the July 2009 revision no longer includes injury to others or causing severe damage to property. A person who intentionally uses an aversive intervention or intentionally violates the requirement of this statute is subject to disciplinary action. If the principal administrator feels that the incident requires further investigation because the incident may have involved an aversive technique, an inappropriate restraint, or abuse, the administrator must complete the following: interview school staff involved in the alleged incident and any witnesses who observed the incident, including the teacher, teacher's assistants, or other school staff. Interview the victim as well as other students where appropriate who may have witnessed the incident. Write a summary of the results of the investigation to include the findings from the interviews. This summary should be maintained at the school site. If the allegation involves possible physical abuse by school staff, the principal shall notify his or her supervisor as soon as the investigation has been completed, notify school police, and have the victim immediately examined by the school nurse. At all times, the principal must follow district regulation for reporting abuse. If the principal believes there may have been abuse, as a mandated reporter, he or she must call CPS to file a concern.